My name's Bruce Orwin. I'm an attorney, and I've lived here my whole life, except the time I was away in college and then a short period of time in Louisville, but I'm pretty much a lifelong resident. Fortunately, I didn't have a heart attack. I was in Texas with a friend, and we were visiting out there, and we ate in a restaurant, and I came out to get in the car, and I found that I couldn't get my breath. I was very short of breath. It was a little scary, and I didn't know what was really going on. So when I got back, I made an appointment with my family practice physician. I went in to see him, and he suggested that I see a cardiologist. He said something's not right, because I noticed I'd been getting tired. And they did a test where they put dye in you and then put you on a treadmill and look at your heart. And they could see that I was not having sufficient blood flow to the bottom part of my heart. They scheduled another test where they were going to go in and insert stents if they could, but when they got in there, the blockage wasn't the sort that lended itself to stents. So they said we're going to have to do a bypass, which was all very surprising to me because I really hadn't felt bad. So I said, okay, let's get it done as soon as possible. I think that was on a Wednesday, and on Tuesday I was having surgery in Lexington, and I stayed in the hospital there for 5 days. And so I just told myself, I'm going to do what they suggest. I'm going to really follow it. I'm going to take my medicine. I'm going to see the doctor when I'm supposed to. I'm going to follow whatever program they recommend. And they recommended cardiac rehabilitation for me. And fortunately, the hospital had started a program. So I said, absolutely, I want to do that.
So cardiac rehab is basically a supervised training program. It's performed in the hospital or one of the clinics under supervision. It's just like an exercise training, but you are attached to sometimes to the monitors, and we need to make sure how they are exercising, because the exercise you do at home is a different kind of exercise. We want the patients to have that kind of exercise under supervision, and we can teach them what is the best exercise for their heart and lung.
Cardiac rehab, basically it's an exercise program under supervision, right? Who's qualified for cardiac rehab? Anybody with heart failure, anybody with a weak heart, anybody who has a blockage in the heart, anybody who had a bypass surgery, anybody has a valve problem, basically any kind of significant cardiac condition.
It takes about 90 minutes to do the program. I'm on the treadmill and on the elliptical, and then we do some strength training. In any session, I'll have probably my blood pressure checked probably 7 times. So it's a very thorough, good program. The staff impresses me as being very well trained and very, very motivated and care very much about me. I mean, they know exactly what's going on with me. Very welcoming, very friendly, easy to get along with. I don't think you have anything more important to do, because if you can't get out of a chair without being out of breath, your quality of life's not going to be much. And I would rather make some allowances at work, miss some work sometimes to make sure that I'm going to have a good long life where I feel good and want to participate in a lot of things that I enjoy doing.
As a physician, it's very important that we teach them that don't underestimate this important modality. This is as good as any life-saving medication in cardiology for improving your survival. So I think it's a very big achievement from our hospital standpoint that we can offer this important modality to all the patients who are candidates for the rehab.